My name is Michelle Ertel, and I'm a gynecologic oncologist. I grew up in Fort Collins, Colorado, and then did my undergraduate here in South Carolina at the University of South Carolina, and then did my medical school here in the upstate at the University of South Carolina School of Medicine in Greenville. I did most of my third and fourth year clinical rotations right here at Greenville Memorial Hospital. I then completed my residency in obstetrics and gynecology at the University of North Carolina in Chapel Hill, and then went on to fellowship in gynecologic oncology at the University of Pittsburgh. And I was thrilled to be back, to have the opportunity to come back to the upstate to not only serve the patients in this area, but really give back to the educational mission right here where my training started. I take care of women with gynecologic cancer. In doing so, I perform surgery and provide chemotherapy, and then follow those patients into the surveillance period. I also take care of women with benign gynecologic conditions who may require complex pelvic surgery. I chose this specialty because I was initially drawn to cancer care because several of my family members have had a cancer diagnosis. And I really witnessed firsthand the impact that a good cancer doctor can have on a patient, but also the patient's family. When I was a third-year medical student, I discovered my passion for surgery. And gynecologic oncology is a very unique specialty in that we manage both the surgery and the chemotherapy aspect. And in doing so, we really get the opportunity to build lasting relationships with patients and families. I educate and inspire health in my patients by wanting my patients to know that they are deeply cared for in the same way that I would care for my mom or my sister or my friend. A cancer diagnosis is often a really big and important thing. And it is, but it's not the only important thing. And I think that it's my job to really get to know my patient and find out what's important to them and what's important to their family, so that whatever decisions we make helps them to live their lives in a way that honors those values. When I'm not at work, most of my time is spent with my husband and my kids. And when I'm not enjoying time with them, I really like to go for casual runs on the Swamp Rabbit Trail. I enjoy a really good cup of coffee with a friend. And I also really like to watch Formula One races and college football. To schedule an appointment with me, please ask your primary care provider to make a referral to me.